First, I would like to give thanks to the Center of Excellence in Human Development for organizing this workshop or webinar series. And I'm quite happy to be the one to deliver or host this. And I'm looking forward to sharing with you all the knowledge that will help you understand what qualitative research is about. So I think we can go ahead and get started with today's webinar session. And to start off, let me just give you a bit of background about myself. So my name is Dr. Gudani Mkoma. I am a lecturer at the Department of Biokinetics, Recreation and Sports Science at the University of Venda. I'm also an honorary researcher at the SMRC of VETS DPHRU. Currently lead a number of projects, but the ones that I will mention is a project that I'm working on here in the Vembe district, which is on household-based NCD risk factor screening. I'm also a chief scientific investigator for an IEA coordinated project on added sugar biomarkers, and that is a cross-country or multi-country project. So my expertise is in biokinetics, behavioral epidemiology, public health, and my research focus is on life course epidemiology, the intergenerational risk of obesity, non-communicable disease risks, as well as health promotion through healthy lifestyle behavior. So that is just a bit about me. Please feel free to share about yourselves in the chat box and just introduce yourself, who you are, where you're from, and what you're looking forward to learning from today's session. Okay, so by the end of this session, you should be able to understand the following, and these are the objectives for putting together this webinar. For you to be able to understand what qualitative research is and why it's important. Also to help you recognize the different paradigms that shapes qualitative thinking. You should be able to outline the main steps in designing a qualitative study, and you should be able to explain how sampling and data collection work in qualitative research is like, be able to draft a simple interview or focus group guide, sometimes referred to as a topic guide, and you should be able to discuss ethical issues when working with people and communities, particularly those vulnerable. And you should be able to link insights to real life issues in health and as well as in human development. Right. So I want us to now start by talking about qualitative research. And I'm sure you might have heard this before, or maybe in your class, or maybe during engagements, of how qualitative research is like storytelling. So why is it like storytelling? It's because it captures, the lived experiences of people. And to define it, I would say that qualitative research is a methodology that is focused on understanding human experiences, behaviors, and social phenomena by collecting and analyzing non-numerical data. And this data will include, words, it will include images, it will also include observations. And unlike quantitative research, qualitative research focuses more on the why and how. And that is what we aim to get when we conduct this kind of study. And also, when we compare it with quantitative research, it allows for what we call depth. And this is very important because if you are to understand how people feel, you would want to get their experience from their own viewpoint. For example, if we are talking about a vaccine during the COVID, there were quite a number of issues that came about vaccination, a lot of myth, a lot of misinformation. So qualitative research was very useful or very integral into understanding the perceptions and feelings about vaccination during that time, something which quantitative data was not able to help us understand. So this is why qualitative research is very useful. It really is instrumental. And the other part of it is that, while we talk of these issues that are affecting individuals, it is also very flexible because it's much more participant centered. So when it's flexible, we mean that you are able to bring insights to things that us as researchers probably didn't think that this should be of concern. The participant has a voice to bring in things organically that were probably arising from the current situation that they are experiencing. And as a researcher, you might not necessarily be familiar with that. So that's why it's quite important and why it's quite useful into understanding how people feel. So these are the things that I want you to understand about qualitative research. I want you to take note that it prioritizes depth and richness over breadth. So by depth, it means that we are going deeper into understanding why certain things are happening and how they are happening. And it is very much context dependent. So we know that, in different areas or different spaces, people will perceive things or experience things differently. And this type of, data or research is perfect exactly is perfect for understanding exactly that. We are able to now grasp the different viewpoints of individuals in different settings. For example, if we are to talk about how the congestion of primary healthcare facilities is affecting individuals in South Africa, you'd find that the experience of individuals who are here in the Bembe district is not so similar with those in Gauteng province. And that's mainly because in Gauteng, there are so many people living there as compared to people here in the Bembe district. So the experiences will vary. However, there will be other things which would likely be similar. But we are able to capture all of that with qualitative research. Another very important point I want to make is that it is constructive and interpretive. So here, the goal is to seek to uncover meanings and perspectives rather than, the objective truth. So it's very important that, we take into account how various things are interpreted within the context where individuals are. So, for example, there are some words that we use in our everyday language which have some meaning, which are not necessarily objective. For example, if I was to make reference to, using slang language, or referring to a bunny chow as a quarter, if we were to talk objectively, saying a quarter would not make much meaning, but to the people within the communities, they know what it means and how to refer to it. So that is very important for us to uncover, and we can be able to uncover this through qualitative research. We are able to understand different meanings within the context where the individuals are. And qualitative research usually uses methods like interviews, and interviews would involve or include things such as focus group discussions, and these focus group discussions will utilize what we call a topic guide. So a topic guide enables what we call open-ended questions. Why open-ended questions? Because the open-ended questions allow for the participants to share their views without a limit. They can be able to fully express themselves to an extent where they feel satisfied with the content that they're sharing. And that is what, as researchers, we are looking for. We want to have an in-depth understanding of the phenomena that is taking place. And I've mentioned the flexibility. So when I talk about flexibility, this tells us that, while using this method, you are able to adapt the methods, in real time. And you are able to also, grasp new insights. And this enables you to fully explore, issues to an extent where, you are able to understand exactly what is happening or answer the question why and how. So it's very important to know that qualitative research embraces subjectivity, reflexivity, reflexivity, and recognizing that both the researcher and the participants contribute to meaning making in the study. So here it's not just one-sided type of research. Here both the researcher and the participant actively participate into making or contributing to the meaning. So I hope that gives you some understanding of what qualitative research is right now. So I'm going to move on to the next part of, why qualitative research? Why is it important that we conduct qualitative research? And the first part I would like to talk about is that qualitative research is holistic, or it enables holistic understanding of human experiences. And this is enabled, or it's made possible by revealing the nuances and complexities that quantitative data might overlook. We know that with the numbers, if we are saying, we want to test for the relationship between blood pressure and body mass index, the numbers will tell us that so many individuals, were obese due to their BMI. So many individuals had high blood pressure due to measurements of blood pressure. And, there was a significant relationship between body mass index and blood pressure. However, we will never get a sense of understanding why so many individuals were actually obese. So their own views in terms of what has contributed to them becoming obese. What are some of the barriers that made it difficult for them to live a healthy lifestyle, and that is a lifestyle of adopting physical activity, healthy nutrition, and so forth. And that's what qualitative research enables. We are able to get those kind of nuances and complexities that will shape individual lives. It is also very essential into exploring areas where little is known or where the subjective experience is key. And this would be like in areas such as cultural practices, personal identities, healthcare experiences, or social behaviors. So this is quite important because we know that within communities, quite a number of lifestyle or behavior or health related aspects are shaped strongly by cultural beliefs, as well as beliefs in religion. We see that also the way people identify. So here we're talking of issues such as gender. They also contribute to how individuals themselves are able to adopt a certain kind of lifestyle. So this is very key for us to understand if we were to really understand what is contributing to the healthcare of or the health status of these individuals. So through qualitative research, we are able to experience or we are able to explore these kind of issues. And it's also quite useful and very important into theory development. And that is by now when we look at generating a new hypothesis and concepts grounded in real world observations, qualitative research is very important into that. I know you know quite a number of theories, such as your theories of behavior change, the health belief model, and so many others. So through qualitative research, we can be able to now review how these theories have been, implemented or have been adopted in real world settings. It's also very important in giving the voice to the participants. And this is quite important because not so many, participants feel that, their voice is being heard when we publish research and when we have our findings in high impact journals and so forth. So when we actually engage in qualitative research is a time when now we get to sit, the participants get to share with us their view of what is the problem, how is the problem affecting them, and how the problem can be sorted out, or what is the possible solution to addressing the problem. It's also very useful, or it's quite impactful into supporting evidence-based practice. And by evidence-based practice, we are talking about fields such as ours, health sciences, social sciences, education, and so many others. Because here, the participants are able to now give comments on exactly if what has been implemented or what is being used is actually working. Do they feel that it's working for them? Is it saving them? Or there are still some opportunities to improve? And we also use it to uncover hidden stories in health disparities. And this is quite important because there could be, other issues that we do not necessarily understand. For example, during the COVID-19 pandemic, the many stories or the many myths that came with COVID, that they're trying to reduce the population level, they are trying to control people, and so many other issues. That hindered people from actually going to vaccinate and giving themselves a much better chance of protecting themselves against the COVID-19 virus. So it was very important for us to uncover such kind of hidden stories, which would eventually lead us to understanding why so many people were hesitant to vaccinate. And that is why qualitative research is quite useful in that regard. And I would like to give you another real world example. For instance, with a survey, you might be able to show that 30% of mothers, miss, for example, postnatal visits. And while that is true, but you will never get to know why are they missing, and how is it that they don't feel bothered by missing these visits. And through qualitative research, we can be able to understand why they are missing these postnatal visits. Is it transport issues? Is it because the facility is in another region or in another province and there's no accessible facility nearby? Is it because they don't find them useful to attend? All these kind of questions, which actually would help us understand why they're not, going, or why they're missing the postnatal visits, are very important for us to start putting together strategies to assist them into, adhering to these postnatal visits. Okay, I will pause there for now and see if there's any questions that the audience or the participants are having that I can respond to before I move on. So feel free to just drop questions. It will be good to hear what some of your views are, particularly into understanding what qualitative research is and why it's useful. For example, in your own fields, why do you think it will be very integral to conduct qualitative research? Please do share your views and thoughts around that. And now I think I will move on to my next slide. And now I want us to talk about the paradigms. And this is very important for us to understand, particularly when we want to conduct qualitative research. Um, so you have to understand that qualitative research, is very integral, or it's very important, instrumental into understanding human experiences, perceptions, as well as feelings about certain phenomena. So for us to understand this, there are various ways we can be able to make meaning or interpret, how these experiences are being shared or how these views are. And it is very essential for exploring, areas where there is very little knowledge, and where, there's a need for understanding the subjective key issues such as culture, religion, different aspects of social behavior, as well as, healthcare experiences. And these paradigms are going to help you have an understanding or solid grounding of what exactly is happening. And to start off, I will start off with the first aspect, and that is ontology, or the nature of reality. So this aspect, if we are to look at the paradigms, we have two of them. And the first one is the positivism, and the second one is the constructivism. So when we talk of ontology or nature of reality, when we look at positivism, this is where now we are only focusing on a single or objective reality. So this is much more, if we're talking about a single phenomena or objective reality, when we talk of objective, we are now talking about certain types of measurements. And when we look at constructivism, this is where now we talk of multiple issues or subjective realities. So this is a number of issues that are coming together to actually, affect individuals. And when we also look at the nature of knowledge, and looking at positivism, this is where knowledge is objective and is measurable. So already you can see that positivism is mainly emphasizing the quantitative or empirical methods. And that is where you are able to measure, certain issues. For example, you are able to test for a relationship between blood pressure and participation, blood pressure and the nutrition or diet. And the data there is much more factual because you have measured it. However, when we talk of constructivism, this is where, active participation, or an active participant and the researcher, come together to actually give meaning or create meaning to what is, the phenomena that is taking place. And we are able to now understand meanings from participants' perspectives, and not necessarily, from the viewpoint of the researcher. And this constructivism is much more emphasized with qualitative methods, and this will include methods such as, your interviews. I've mentioned in-depth interviews, focus group discussions, as well as observations. So observational studies, your also, as well as case studies. This is where you will see constructivism being very much emphasized. And the kind of data that we have here is in a narrative format, and we now interpret these narratives so that we now uncover the meaning or the depth of the issues that are coming out. So that is what I will talk about when we talk about the philosophical paradigms, and it would be very good to hear what your thoughts around this are. If you've ever conducted qualitative studies and these were things that you actually looked at, and this is what you actually considered when planning your qualitative studies. So I'll pause a bit and go to the chat and see what we're getting. Okay, I'm seeing some activity from Monica and Matsidiso. So Matsidiso says that educational psychologists in Ekurhuleni. Oh, she's an educational psychologist in Ekurhuleni, and she'd like to learn how to begin to design questions to answer a question of a problem you are researching. So I think here she's talking about designing a qualitative research study, and that will do very much with the question she aims to answer. Okay, so my next slides are going to help you have understanding of how do you now design your qualitative study. So please be on the lookout for that. And Monica shares something on the chat box, and she says, why qualitative study, and why is qualitative study useful in the field of sociology? Okay, so she just tries to give insight on why it is ideal. So I think she was answering that question which I asked of, how do you think qualitative research is useful within your field of study, and how can you apply it to answer some of the most burning questions that, you don't necessarily have answers to. So she has expanded on that, but in the interest of time, I will not go through all of that now. I'm just going to resume with the next slide. I will read most of this as we move towards the end. Right, and now I want us to talk about the designing part. And this is what I think many of you are quite interested into knowing and understanding, because this is quite integral for one to understand, as this is the portion that will tell us what your study is and what your study is about. What are you going to do, and who gets to be involved, and so many other things. So when designing a qualitative study, it is essential to frame your research carefully. So I'm going to break it down for you so that you are able to understand what I mean by that. So, for example, you need to ask yourself quite a number of questions, or a couple of questions, for you to be able to know if the study that you've designed is well to actually answer the questions that you have been asking. So number one, what do I want to understand, or what do you want to understand? And an example of questions to ask yourself in that regard would be, what is the phenomenon or experience that I'm curious about? And what do I hope to learn that is not evident from the numbers or the statistics? What are the underlying meanings or perceptions behind these topics? So this is very important for you to ask yourself, as this is going to guide you into understanding, what do I want to understand? If you have that question in mind, what do you want to understand? You will now start looking at who has the experience with it. And some of the example questions that you could ask yourself would be, who has lived through or observed this experience firsthand? For example, if we were to talk about COVID-19, it will be bizarre for you to interview you know, anyone who was born after the pandemic has subsided or has gone down, and we have achieved what we call herd immunity, because they will not have the experience. But if you really want to capture the full experience and observations of what was happening, you would want to interview individuals who probably were diagnosed with COVID-19, who recovered from it, who endured the many lockdowns, who got hospitalized, and so many other issues. So that's where you'll be able to, have this solid understanding of, that phenomena that happened. So this is very important for you to understand or be able to identify or ask yourself who has the experience with what I'm looking to understand. This is also useful when you're trying to understand how, for example, using NH or how NHI is going to impact, primary healthcare. You will not be asking this from, an everyday individual. You'd want to look at the experts, for example, those who have developed the framework or the policy. You will also want to engage with those who are going to have to implement this NHI, and that will include your primary healthcare workers, such as nurses, doctors, and how this would affect individuals, who are supposed to be receiving the care. So those kind of things are very useful for you to know firsthand before you start saying this is the kind of study that I'm going to be conducting. And you also need to ask yourself the question, how will I collect their stories? So you need to know exactly how you're going to be gathering that information for you to be able to understand this phenomenon. And that entails you asking yourself questions such as, what methods will let participants express themselves fully and authentically? For example, if you want to ask participants on issues of gender-based violence or intimate partner abuse, you would now need to think exactly, would using in-depth interviews or using focus groups serves me better? Which method will be suitable for you to enable that environment where participants can fully express themselves without limiting or holding back some of the information? So you need to be in a position to understand that. And you also need to ask yourself a question: how can I build trust and rapport to encourage openness? So remember, I've mentioned that qualitative research is all about going deeper. So this means, asking individuals about very personal issues that in some instances, some of them have never had an opportunity to share with anybody. For example, if we are to talk about pregnancy termination, there could be participants who feel very reserved about sharing such information, because then it sparks some sort of personal emotions that would see them regretting or feeling like they did the worst thing that a human being could. And so such kind of topics would want the participants to have trust in you, also feeling that this is a person that I can be able to share such very intimate information with. And it's very important that you know exactly the kind of methodology you are going to use in order to capture or encourage that openness with the participants. Okay, and feel free to ask me any questions with regards to this, especially if there are some areas where you feel that it was not quite clear for you, because this is very important. These questions are very important to know, and this is where, as a qualitative researcher, you need to be starting when you're designing your study. These three questions, or three broad questions, although I've broken down into multiple questions are very important for you to ask yourself in the planning stages. Right. So now I want us to start talking about the research designs. And this is very important for us to know because with research designs, we are now able to know the methodology, the kind of data collection we're going to do, the participants who are going to be involved, and so many other issues. So literature does show that there are, is a number of designs that are out there. But for the interest of this webinar, I'm mainly going to be focusing on the 5 major qualitative study designs. And this is what you would find in many publications in the scholarly systems, or in libraries. You would find many of the literature talking or mentioning these designs. And to start off, I will start with the phenomenology design. And this is about lived experiences. So this design focuses on exploring and understanding people's lived experiences, the meanings they give to those experiences, and the researcher gathers data mainly through in-depth interviews and analyze it to find the core essence of the phenomenon being studied. So already here you are able to a sense of what exactly would be the kind of data collection you're going to do. So if we are talking about sensitive topics, if we're talking about um, topics that would make people feel very uncomfortable, and this will include topics such as, gender beliefs, or issues on, stances on abuse, stances on sexuality. Those are topics which not everyone will openly want to discuss in a platform where there are multiple individuals. So in these kind of instances, this is where the lived experiences or phenomenology is very useful, because you are able to have in-depth interviews. So in-depth interviews will involve a one-on-one session where is the interviewer and the participant engaging and sharing insights of what exactly is happening with their lives. And the second design I'd like to talk about is ethnography. And this is where, as a researcher, you observe people in their own natural environment. So ethnographic studies or ethnographic design is very useful into understanding people's cultures, behaviors, social interactions, as well as how people are living with each other. And you do this by observing them in the settings or in the context where they are, which we'll call their natural environment. So here, this is where you'll find researchers, often spending a lot of time living with or in a community that they, are not necessarily from. And this is mainly for them to be able to gain this deep insight and contextual insight. For example, if you want to study how, Zulu culture influences, or shapes health behavior, for you to be able to understand how the cultural beliefs actually shape health behavior and decision making when it is in regards to health, you would want to go to the community, to their community, live in that community, and then from there, it becomes much more easier. You are able to observe how culture literally affects how these individuals are able to make decisions in relation to their health as well as behavior. So that's what ethnography is about. And then the third design is grounded theory. So, like it says that, as it says, grounded theory is all about building theories from data. So here, the aim is to develop a theory based on the data collected from the participants. And what happens is that researchers gather and analyze qualitative data to find patterns and relationships which help build a theoretical framework about a process or a phenomenon. So, for example, let's say I want to, you know, think of a way I can engage, I can promote engagement in physical activity. For me to be able to do that, I would want to, think that okay, individuals do certain activities or would act on certain things mainly because they think that there is a benefit to it. So that would be my theory, that okay, there is my theory is that people will only do things when they feel that there's a strong benefit to it, and I can be able to collect data on that, see if it's really the truth that for individuals to really engage in certain things, particularly in relation to their health, they will have to understand what the benefits are, um, to them engaging it. And from there, I can be able to build a theory. This is why now you can find many theories within literature, such as the health belief model, the theoretical domains framework, and so many others that are useful into helping us understand how people behave or how people take certain actions to their health. And moving on to the next study design. And the next one is the case study design. So here, case studies, they are much more um, designed to be in depth, and the focus is on examining one or more cases within a specific context, and this could be involving an individual, a group of people, an organization, or an event. And the main goal here is to understand the context, complexities, sorry, pardon me. So is to understand the context, complexities, and the process over time using multiple data sources. So here, when we talk about a case study, already when we say over time, you can get a sense that this is a type of a longitudinal study, meaning that you follow up on that case for a certain period for you to be able to understand these complexities that are affecting, it can be an individual or a group of individuals or an event that has been happening. For example, if I'll make reference to the COVID-19 case. So COVID-19 could be a good case study because from there we are able to track how it started, after it started, what happened over the years, that until to the point where we said that, the country such as South Africa has achieved what we call a herd immunity. So we can be able to investigate such using a case study. And the last design I want to talk about is the narrative research design. And this is quite important to know, because here the researcher collects and analyzes stories from participants to understand how they interpret their experiences. So here, this is more of a design that will allow you to capture various stories from individuals. So if we're going to talk about historical topics, what happened during apartheid, what is happening with certain individuals living, for example, if we're talking about individuals living in that era or in that time of apartheid, what contributed to their livelihood, what shaped their, their health, how was it like for them to be able to access healthcare during that time? Was it difficult? Um, was it free for them to access it? Was it easy for them to access, compared to the current times where we are now able to say that healthcare access is free, no one should be deprived of healthcare access, and that if anyone is ever deprived of healthcare access, therefore it is an issue against their rights as a human being. So through narrative research designs, you are able to capture or collect those kind of stories from individuals, and the main focus of events is coming up with the meaning, or having testimonials of how certain events actually affected certain individuals or specific people. Would see this kind of data collection taking place in cases where there were massacres. So if we are to talk about the Maricanas issue, this is another example, or another good example, where you can be able to get the stories from the individuals who were affected during that time, and how the events unfolded. If I were to give another example, the event of the Lily mine, where those miners got stuck underground. You can be able to write or collect data of the stories of those miners who were part of the that mine, on how everything unfolded, what led to the mine collapsing, and so many other issues. So those are some of the examples that I'm just thinking of at the top of my head to help you understand what kind of data collection this would be, and how it could be useful into helping us understand how different events unfolded during the time, they were taking place. Okay, so I will pause there for now before I move on to issues of sampling, and just see if there's any questions within the chat box, so that we can be able to answer. Okay, so I see here, and this is from Shamiso. The question was, is there much of a difference between phenomenology and narratives? And I think I've just explained it now as I was talking about the study designs. So I hope, Shami, so you were able to hear my explanations. If they were not clear, please drop a chat, and I can elaborate further on the differences between phenomenology and narratives design. It's very important that you are able to distinguish the differences. Number one, with phenomenology, you are going in depth. So this will involve you, collecting data with participants, or with the participant on a one-on-one basis, whereas your narratives are quite useful into understanding stories of historical contexts. For example, past um, events that have occurred, and that would want you to understand how things unfolded. If we were to talk about how COVID-19 unfolded in South Africa, we can have individuals giving us a narration of that, and that is the difference between phenomenology and narrative design. Okay. And I see how to generalize the findings as qualitative data is not from everyone. can we be confident in a provincial or national study? A very good question. And I will cover that aspect as we are going now into the sampling, and but maybe to just give you um, the answer is that qualitative studies are not about, remember, the sample size with qualitative study is not about the power. So if we are to talk about generalizing findings, we will have to talk about statistical power, and that's where quantitative research mainly comes in, because we are now able to have a sample from a specific population, and that sample we can test that it has enough power for us to be able to generalize the findings as we have found them. So with qualitative, the focus here is more on depth, and depth means that we are able to understand the why and the how part. So the why and the how part might not be for everyone. So this tells us that we cannot necessarily generalize the findings. So if I'm here in the Bembe district and the people here in the Bembe district are telling me or sharing insights that the reason why they are not going to primary healthcare clinics is because the service there is poor, or there is a shortage of personnel, and that will be your nurses, doctors, and so many other personnel that are supposed to be there. There's a shortage. It does not mean that few would be the same for people living in Gauteng or in Soweto. So it's very important that we understand that the type of data collection we are doing is focusing more on capturing the depth, understanding the why and the how part. That will help you understand. So we cannot necessarily talk about generalizing the findings from qualitative data. I hope that that helps you understand. And Jessica just mentioned that she would like an explanation on narrative design, and that's what I've just covered before, talking about the generalizability of qualitative data. So I think I've answered that question already. So I will not go back because I see that our time is going, and I still have quite a number of things to talk about. So I'm going to move on to the next part. And here I'll be talking about the sampling. And this is a very important part about qualitative data, because I know that if you are influenced strongly by quantitative methodology, you would easily think that this part is not as important for qualitative research. There's quite a number of misconceptions around this part. But I think, by the end of our session, you should be able to have an understanding of what it means. So I've titled this sampling for meaning. And it's very important to know that, sampling in qualitative research involves deliberately selecting participants or cases that can provide rich, meaningful insights related to the research question, rather than aiming for statistical representativeness. And this is what I was talking about earlier when I answered the previous participant. So here the focus is on the meaning of the data rather than the representation. So there are different ways that we can be able to, capture this meaning of data, and that talks about the sampling methodology that we can adopt. And the first one being purposeful sampling. So with purposeful sampling, participants are chosen intentionally based on a specific trait or knowledge that matter to the study. So what this means is that, it's not everyone that can be a part of this kind of study. It means if we want to understand why stroke patients, or the quality of life for individuals recovering from a stroke, obviously we won't be asking individuals who are living with individuals affected by a stroke. We will only purposefully recruit or engage with those living with or who have recovered from a stroke. And that's what I mean when we say it's purposeful sampling. So this type of sampling ensures that those selected can provide valuable insights. I'm sorry. And here you can be able to select a range of diverse cases, and you can be able to choose, typical cases such as, looking at individuals who have recovered from a stroke to individuals still living with a stroke or individuals recovering from a stroke. So you are able to now, have variations of those kind of individuals because you have purposefully selected them. So it's very important that you understand, why purposeful sampling is important for the for capturing the meaningful insights. And a good example to help you understand this is that, if you want to talk about issues such as, or a sensitive issue such as cancer or recovering from cancer, the sample could involve different cancer survivors. Remember, cancers, they are different, right? You've got your breast cancer, you've got your testicular cancer, brain cancer, and so many other types of cancers. So depending on which cancer you want to focus on, it means that that's when you will know who to purposefully select. And that could also involve selecting those who are probably, just recently recovered, those who have been living with cancer for a long time, and those who have recovered and it's been years since they've recovered. In that way, you are able to now understand or capture the meaningful, or go in depth to capture what exactly do they have to go through until that recovery. And those who are still living with cancer, what are they going through? What has been the process, or how has their life been changed ever since they got diagnosed with the condition? And then the other type of sampling that I will talk about is the snowball sampling. Now, this method helps this helps reach the hard to find groups. And, the first participants here usually suggest the next participants. So in a way, if you have people living with a rare condition where, for example, if we are talking about Marfan's syndrome, it's very rare that you will find someone who's living with Marfan's syndrome, but these individuals would be in a position to know individuals with a similar condition because they go to rehabilitation sessions with them, or they meet in certain places where they are able to get their treatment or care for such rare conditions. So this means that you are able to use the snowballing sample for you to be able to identify these hard to find groups of individuals. And this could be through referral, or where one participant suggests that, Gudani could be your next participant. He's also living with this very same issue. And then we've got what we call theoretical sampling. So this is often used in grounded theory research, and this method involves picking participants based on new ideas and developing theories. Here, researchers adapt their sampling as they collect the data to explore better and understand different theoretical categories. So I'm going to move a bit faster so that the time is not too off. I see we are left with just a couple of minutes. And then the most common one, which most people probably are familiar, or maybe all of you are familiar with, is convenience sampling. And this is where participants are selected based on how easy they are to reach while this is very practical, it may not provide that deep or diverse information because, I mean, it's convenient. For example, if you want to understand, how using drugs affects communities, if you're only just going to ask, any individuals who comes through, you will not be able to actually fully cover the extent of how big of an issue is, drug abuse within a community. So you would want to, engage with much more individuals for you to be able to fully understand at what level and how bad is this issue in relation to the communities. So in qualitative research, you don't need to have a very huge sample, but you need people who know the topic that you are going to be investigating deeply. And this is very important because you will need to capture those deep insights. You will need to be going in depth for you to make meaning or generate meaningful findings so that we can now answer the why and the how part. I hope that helps make that part on sampling clear. If you have any questions with regards to the methods of sampling, please share them in the chat and then I will tackle them as we go. Now, I want us to talk about the issue of the sampling size. And this, I recall, was a question that was brought upon earlier in the chat box as well. This is very important because sampling size tells us exactly how useful that data is. We talk about issues of trustworthiness. We talk about, issues that, how reliable is this information? And, compared to quantitative, research, qualitative is not about statistical power. And I'm repeating this. And it's mainly about the richness and depth of the data. So here, this is where you get to see very small sample sizes. And, literature shows that for quality data, researchers need about 8 to 20 individuals. You will be able to, generate insightful or rich data when you have that sample size. And these are some of the general guidelines into understanding, qualitative research sample size. And the first part I want to talk about is that, qualitative sample size is guided primarily by the concept of data saturation. So most studies show that, saturation is reached when you have gone through 12 to 20 participants. And this is the point where collecting additional data no longer yields new insights or themes related to the research question. So understanding data saturation will help you understand the issue of qualitative sample size. So this tells you that you cannot necessarily base the sample size on a specific quantity. The saturation part is what tells you when do you stop or should you still be continuing. So let's say you have reached that 12 participant and there are still new insights coming. That will tell you that you still have to continue interviewing participants until now there is no new insights that's coming out or no new themes that are related to what you're asking that are coming out. So it's very important to understand that the different methodologies as well would have some sort of restrictions or limitations in terms of how many participants you can interview. For example, with phenomenology or in-depth interviews, like I've mentioned, that phenomenology deals with in-depth type of data collection. So this is the one-on-one. So less around 8 interviews would actually show that richness and depth of data. So usually you would have less than 10 participants for you to achieve saturation. And it's very important that you know exactly how do you identify that saturation has been achieved. And then with grounded theory, you often need 20 to 30 interviews for adequate theory development. Remember, if we're talking about a theory, this is where now you're going to have to apply it to a wider audience. So it's very important that you are able to, test it and also capture the experience of how, different individuals are feeling with that certain phenomena for you to be able to now develop a theory that will be context relevant as well as, useful and acceptable within that specific context. So, if we are to talk about focus groups, you would typically saturate around, 4 to 8 groups. So this type of data collection will make it easier for you to achieve saturation because multiple individuals are involved in the discussion. And it's very important that you are able to know which methodology, which study design requires you to use focus groups, which study design requires you to use in-depth interviews, and so many other options. I hope that helps you understand the issue of why the sample size for qualitative research is different from the quantitative research, and how um, to actually make meaning of the findings that you'll be getting from these type of participants, or the sample that you'll be that will form part of your study, and why the issue of generalizability is not the main focus here, because the main focus is on depth and richness. So the why and the how, as I've repeated, is the part that we are trying to answer with this kind of data collection. Okay, I'll pause there for now and then see if there are any questions. I see a question on purposive sampling that is asked in the chat. Pardon me, my slides have gone forward. Okay, I don't know what happened. I'm now seeing that our time is moving so quickly. I've not realized that we actually left with like 9 minutes. So I think I will attend to the questions at the end of the session. I might as well just try and wrap up with the presentation, and then we can have any engagement after the presentation. So I'm going to talk about so now that you have designed your study, you know who your participants are going to be, you know the kind of data you want to collect, then you will have to now know, what data collection method are you going to use. And this is where, it gets quite critical. And this is the part that tells you how rich your data is going to be. And I will start off with the semi-structured or in-depth interviews. So here, you use a flexible interview or topic guide with open-ended questions that allow the researcher to explore participants' responses in depth. And this method combines the consistency of a structured approach with the freedom to probe further on participants' answers. So this tells you that besides what you have put in place, or the questions that you have put in mind For example, if you want to understand why certain individuals are not comfortable attending their health checks in primary healthcare or government healthcare facilities, you can be able to probe even further to understand exactly other issues that are contributing to that issue. So that's the probing. So the semi-structured nature of this topic guide allows you to be able to probe some more and get much more insights from the participants. So, and then the next data collection is focus group discussions. So here, like the name says, focus group discussion, this will involve, about 6 to 12 participants, and these are participants who share this, the same norms. They have similar characteristics. It could be young women, young men of the same age, living in the same area, who are experiencing the same events or same issues. And this is where you are able to capture collective views and social dynamics, as well as diverse aspects on a specific topic. For example, if we were to talk about COVID-19, so we can interview young people from here at Bembe on how was their experience, living in that period where the country was having COVID-19 lockdown. And from there, you will be able to capture, what was the same experience in relation to, those young people, what was the same for them, what was different. There would be those who are saying, oh no, I was not so happy because, I was on lockdown the whole entire time. My parents didn't want me to go. Others will tell you about how they had to sanitize their hands every time they go to the shops. Others will tell you about the restrictions that they had, that they could now not be able to socialize with their friends, give hugs, hang out at the parks, and so many other issues. And that's what you can be able to, capture with this type of data collection method. And then the next type of data collection method is the observation. And this is where, as a researcher, you are able to take field notes on behavior and activities of individuals at a specific site. So this entails you systematically watching and recording behaviors and interactions as they occur naturally. This tells you that you do not necessarily mingle or you do not manipulate, if we are talking in a sense of quantitative research. So you do not manipulate anything. Everything has to happen in its own natural way. And the main thing that you do as the researcher is to observe, listen, watch, and record what is actually transpiring. And this is very important or valuable in studying processes, social interactions, how different people are living within a specific context. And also, it's very useful in documenting things or issues that are very difficult to verbalize. So this type of data collection would be quite useful for that. And then lastly, we talk about document analysis, and this involves reviewing of existing documents, existing text, could be policy documents, could be certain laws, and so many other issues. So here you are able to have some background knowledge about the context, and as well as it's able to complement some of the data collection tools or the existing data that you'll be having. For example, if you are having quantitative data that tells you how certain diseases are prevalent, through this type of analysis, you can be able to have that complement after conducting it. So, and that mainly is dependent on the researcher reviewing the existing text and reports and letters and so many other types of data that will be available. And that's all I can say for the data collection methods. Now that you know which method would suit your study, or which method you should be going with for your study and the kind of data that you want to collect, whether you want to interview participants on more intimate issues, whether you want to get much more social constructs of views, affecting a wider range of individuals, whether you want to review or complement, specific data that's existing and you want to review certain policy documents, or you are thinking of developing a specific theory. Now, let's talk about this very key item that I've talked about, and that is the semi-structured interview guide or topic guide. And I've put that the semi-structured interview guide is mainly used during an in-depth interview and a focus group discussion in this case, because that's the most common instances where you will find. But you will see as you read further that there are also other instances where you can find this semi-structured topic guide or interview guide very useful. So let's start first with understanding what a topic guide is. So a topic guide is a list of open-ended questions and prompts that helps you explore your research in depth while giving participants the freedom to express their views and experiences. So the purpose of this topic guide is to ensure that you are consistent and that every participant is asked about the same broad themes. It helps keeps the discussion relevant to the study's objectives. Remember, the whole point of engaging or doing research is for you to achieve specific objectives. And using this topic guide will help you, stay in that relevant, maintain that relevancy to the objectives. It also encourages a natural and conversational flow. And that is very important to take note of, because when you are interviewing individuals who are to share their own perspectives or experiences about specific things, you need to make it sound more like a conversation rather than an interview, because an interview is much more structured and it mainly focuses on answering the questions that are being asked. Whereas when we talk about your in-depth interviews and focus group discussions, we mention issues of open-ended questions, meaning that the participants are able to elaborate even further and bring in different insights or insights that are still very relevant to the question that you're asking, but could be things that you might have overlooked or have not fully thought of in that regard. So what exactly to use this topic guide? And it's very important that you must know that the topic guide is useful before data collection, during data collection, and after data collection. So why is it useful before or why is it used before data collection? So it's very important that you know as a researcher, when you're developing and piloting it, you have to see to it that this semi-structured topic guide is going to be based on the current existing literature, the theory, as well as the study objectives. So this is where it's very useful for you to pilot test it as a researcher, because you will be able to now to review it as you would need to, and that is based on the feedback that you'll be getting from the pilot participants. So a good example of this is drafting your questions, such as, how do you experience antenatal care? And this is where you will see if the way that you've framed the question is actually enabling the participant to respond to you in a way that is not restrictive or that promotes that open-endedness that I've been talking about. And during the data collection, so the guide is used in interviews or FGDs to direct the conversation. So it's not necessarily a read word by word type of instrument or guide. So it's much more flexible. So you would think of it as a sort of a compass that will be directing your conversation. So this tells you that at any point you can be able to probe even further for you to be able to understand, in depth other issues that would be arising due to what the participant is saying or due to the feelings of the participants at that point in time. So it's very important that you understand that you don't necessarily have to stick to what is written in that guide. And then after the data collection, this is where your topic guide, it helps you with your analysis. And this is now when you're now talking about the stages of developing your themes. You can be able to compare your themes with the questions that you had. Is what I'm getting the same as what I've captured in my questions? Do I see this information coming out? It also helps you now think of the kind of themes that you will have to develop for you to be able to capture the data that the participant has shared with you. And that's all about talking about when exactly is the topic guide used. And I want you to remember this part about the semi-structured nature of the topic guide. So this semi-structured nature of the topic guide simply means that your guide is partly planned and partly open, meaning that you have now thought of or planned the kind of questions that you would want to get or ask the participant so that you are able to get specific responses to understanding that phenomenon. However, it also allows for unplanned questions to be asked as well. For example, if you are talking about the issue of losing weight, or you're talking about obesity, and a participant is now talking about different um, experiences of living with obesity and so forth. And within that conversation, this participant just tells you, okay, then at some point, someone told me about using Ozempic as a quicker way of losing weight. You wouldn't want now to understand what exactly is Ozempic about. What was the experience with using Ozempic? Did they use it? Or if they did not use it, what was their stance in regards to that? And if they have actually thought of other means, of losing weight, and if they prefer, methods that will help them lose weight quicker rather than the more traditional method that we know, which is eating a balanced and healthy diet as well as exercising, according to the recommended levels, which is over 150 minutes of moderate to vigorous physical activity in a week. So you would want to know if the participant stands in that regard for you to be able to understand such issues. That's what I mean when I talk about the semi-structuredness and the partly planned and partly open. So it's also very important to note that you can always change the order of the questions that you have in your topic guide, because it could happen that with some participants, the way they are able to now share insights or share their views, they are able to organically touch or talk about your next questions without you even asking the question. So when you see all of that happening, like I said, it's the key issue is that you make the engagement to be more conversational rather than an interview, like a structured interview. So if it's happening in that type of way, it means that now you now need to think, okay, so this aspect and this aspect has been touched upon, then what is the next follow-up question that you should be asking? So as a researcher, you need to be very much cognizant of that aspect. Right. So there are also typical situations where this topic guide is used, and this will help you have an understanding of exactly when do you need to develop your own topic guide. And These situations would include when you are trying to explore certain beliefs or experiences of individuals, when you're trying to understand group norms, you're trying to understand how different processes are working, so process evaluation. You're trying to experience to understand the health services reach, accessibility and those kind of things. So you can be able to um, apply the use of a topic guide, and this will also tell you the kind of study design that will allow you to use a topic guide, and such as your exploratory studies, your focus group study, mixed methods implementation study, as well as case studies within a community-based setting and so forth. So you are able to now have a set of questions that will be the that starting or that initiator of the conversation, and other key issues or other aspects of the conversations will be shaped upon as you continue with the conversation. So it's very important to know that when you sit with participants or conduct a focus group, you use your guide to make sure that all of these areas, such as your knowledge, understanding, feelings, emotions, and so the views of participants are being captured. So that means your topic guide should be able to capture, or should be able to allow you to be able to capture or ask participants about these specific items. So designing it very well will see you achieve what we call richness or in-depth, or the depth of the data that we're talking about. In that way, you are now able to make much more meaningful conclusions about what is happening and how is it happening and why it is happening. So that is that about the instrument or the topic guide. And now I will want us to now talk about issues of ethics. And this is very important when we're talking about qualitative research and or research in general. We cannot, talk about collecting individuals' data and leave out the ethical aspect of it. And I will start off by talking about the core principles of conducting ethical research, or issues to consider when conducting qualitative research. And the first part will be the informed consent. We know that for each and every individual who participates in a research study, they have to have given you consent to participate. So you have to ensure that the consent is voluntary and the participant is well aware of the study's purpose, procedures, as well as the risks and the benefits, and that you are going to respect them, as well as being able to say that their information or their personal information will be kept confidential. So you also need to ensure that there will be no harm that comes to them from participating in your study. So if your study is going to inflict any sort of harm, the harm must not outweigh the benefits of the studies. For example, if we're talking about studies that would see some sort of psychological distress coming out, for example, if we're talking about issues of abuse, or issues that are talking about sexuality, culture, religion, those kind of issues could lead to some sort of distress with the participants. So it's very important that the sort of harm that would be caused by your research will not outweigh the potential benefits of participating. So it must always be benefits should outweigh the potential harm that could occur. And in instances where you have some sort of potential harm that will occur, the research ethics committee would want to know, how will you now mitigate these effects? For example, if someone is going to have this distress, psychological distress, are you going to provide counseling services for such individuals so that you don't just leave them with the distress? And then we also talk about issues of justice, and this is where you ensure fair distribution of research benefits and burdens. So research is supposed to be fair in all essence. So you do not have to say specific individuals are going to have this type of benefits, and then specific individuals are going to have this kind of burdens. Everyone must have a fair distribution of whatever it is that is going to be a part of the study. And you must always avoid exploitation of vulnerable populations. So this will include issues of exploiting kids, people who are poor, because that once individuals are poor and you promise them a bit of money, you can be able to do anything you want, publish their personal information without them even agreeing to it being published in any platforms. So you always have to look out for those kind of things and always be very mindful and ensure that you do not breach those kind of issues. And there's also the issue of promoting equity. So there should not be anyone who gets discriminated against participating in a research study, and mainly because of the social status, who they are as an individual, and any other issue that you would say that you are using as a discriminatory factor. Unless the individual is not willing to give consent, or they are physically or mentally unable to give consent to participate in the study, it's only then when you can say this individual is unable or cannot participate in a study. Otherwise, whether the person is living with a disability or is apparently healthy, they have the same opportunity, or they have an equal chance of participating in the research. So those are very key principles that I want you to remember, and you should always bear in mind when you are conducting your your research. So I want you to also keep in mind when we talk about vulnerable populations, and your vulnerable populations are very important to take note of, so that you are able to conduct your research in an ethical way. And the first population that I would like to talk about is children. So we know that with children, you are not able to get consent. So in this case, you should ensure that you are able to obtain the child's assent, and that is their agreement, as well as their parental or legal guardian's consent. And the kind of language that you are using with this group of individuals or people should be child-friendly language, as well as it should be age-appropriate methods. And this will include like your play-based techniques, and this will allow or enable or ensure comprehension and meaningful participation. So, for example, you know that with many standard consent forms, the language that is used there is for people or individuals who are much more matured, who would have an understanding of what research is about and so forth. But you would find that you're working with children who have no idea what research is. Probably some of them have not even had the concept of research. So this is very important for you to ensure that the language that you're using is friendly, age appropriate, for them to be able to understand what it is that you're going to be doing, and that the participation is actually meaningful for them. So you also have to ensure that the children are protected at all times. So this is very important, because there could be issues that would cause specific problems, such as power dynamics, You as a researcher, being an elderly person, you'll feel like, if the child is not behaving the way you want, you might just say, some harsh things, or you can say that, I'm gonna spank you. You better behave until I ask you all the questions, or until you answer all the questions. So you need to understand the power dynamics, and ensure that you safeguard their welfare at all times throughout the research. There shouldn't ever be an opportunity where now you abuse your power as an older individual and make them feel some way that they have to participate or engage in your research, because there will be some sort of consequences that will come. Remember, participation in research is voluntary. So each and every individual must volunteer to participate. If they don't feel like they want to participate any longer, they are free to walk away and stop the participation. So the other issue that I want you to consider or think about is the cultural differences or cultural sensitivities. When you're going to conduct studies in specific communities, you need to be mindful and well informed about specific cultures, because there are certain things that different cultures believe in, that if you do not take them into consideration, you will actually be infringing on their rights. As well as when we talk about issues of sharing information, you have to consider that in a way that it should be very respectful, very cognizant of their cultural beliefs and norms, and that you are not necessarily infringing on anyone's rights when you do so. So I've put a slide with some examples of vulnerable populations, such as your low income, and the kind of tool that you can use, to enable, good ethical conduct during the data collection or during the research process. So I will not go through this, and I'll share the slides with everyone who is interested later, for you to be able to go through that. Right. So I have provided, sort of an example of different ways you can actually, develop your assent. And mainly because I've mentioned that children are a vulnerable population. It's easy to exploit them. It's easy to manipulate them. And, the ethical way of doing research is that no one should ever be exploited, should ever, engage in research without understanding exactly what it is that is being done or what is happening. So I've provided these examples of how you can tailor, an assent form that is much more age appropriate, as well as the use of language is much more age appropriate. And this will help you, see how do you now move to adapting it to different age ranges, so that you are able to now say that the communication was clear, and it will enable that meaningful engagement with the participants. So I will not waste much time on this anymore. I've seen that our time is moved. So you will see these examples, and you'll be able to compare the differences. So the difference here is mainly about the language, starting from, very simple language, it gets a bit, much more, I would say, complicated, for lack of a better word, as they get older. Because, the older they get, then they start developing, better comprehension of things. And there's where you will see that the language now changes to be much more formal and much more structured. So we can talk about all these, processes, designs, planning your research, your qualitative research, how you're going to engage it, planning the data collection, the ethical considerations, and so many forth. But it's very important that as a researcher, you need to understand the common challenges in conducting qualitative studies. And this will help you, plan better and also understand that when you encounter such problems or situations, what do you do as a researcher? And it's very important to be mindful of the first one, and that is the researcher bias and subjectivity. Remember, the kind of data we are collecting here is textual data, so it's words. So that means that it's very much open for interpretation. So you, as the researcher, you can be biased based on a specific assumption or a specific thought that you had in mind, that this is what I want to actually say about this type of data. And it's very important that you know what you need to do um, for researcher bias to be minimized. And this would entail you having another independent researcher reviewing the very same data. You should be also very much aware of your own bias as a researcher, and you must be very much aware of your own specifics, your own perspectives, and using triangulation as a method of alleviating these challenges would actually see you have findings that are much more trustworthy. And in general publications now, they actually want you to explain how you were able to avoid this researcher bias. You would have to write a statement that justifies how the data coding was done, how the analysis was done. Was there any who reviewed the coding, or who reviewed the data? Was it solely you, or there were other researchers until who reviewed the data codes until there was an agreement reached? So those type of things are very important to think about when you're planning your study. There's also the issue of data collection complexities. So you must understand that as much as it sounds easy to just have a conversation with someone or interview someone, face to face, you get to record their responses and so forth. But collecting qualitative data through interviews and focus groups or observations requires very careful planning. And what I mean by this is that the environment where you're going to be conducting this qualitative data, it needs to be a suitable environment for the data collection to take place. For example, if you're going to be talking about sensitive issues, that means that you would have to have a room that enables or facilitates the participant to engage with you in an open manner without holding back or holding back any sort of information. So the environment should also be very flexible. It should be in a way that allows the participant to be free, to open up. They should not feel like they are in a setting that makes it hard for them to feel safe or feel like they can be open about how they feel. For example, if you're going to talk about intimate partner abuse, and you're doing this interview with, let's say, a woman who is getting abused by her husband right at their home, it will be very hard for you to get her to open up, because the husband could be there, or the husband could walk on at any point in time, and they will just feel like, if he hears that I'm sharing these kind of things with the researcher, I might be in more trouble. So that is very important, that that you plan your data collection very well, and that you are prepared and you have all the resources that are needed for you to be able to conduct this type of data collection. So this also talks to the issue of time and resource intensive. So there's a whole lot of things that are required for collecting qualitative data, and it takes time. Some of these interviews can go on from 45 minutes to an over 2 hours, depending on how much the participant has to share. Remember, I've mentioned that you do not necessarily just end the conversation or the discussion unless the some the information that you are looking for is no longer coming out, or the participants feels that they've shared enough. So that could be particularly challenging. And also issues of analyzing the data itself. Now remember, you are going to be talking about heavy data. And if we're talking about in-depth interviews, let's say you've conducted over 15 in-depth interviews, that's 15 transcripts of pages and pages of data, which would mean that you have to spend an adequate amount of time at first to review the transcripts. From there, after reviewing the transcripts, becoming familiar with it, then start the process of now developing your initial codes and so forth. So it's time and resource intensive, and that will mean that you will have to spend an adequate amount of time working on it. So you need to be very much aware of the challenges that it comes with. So that tells you that you need to plan how you are going to be doing your data collection, doing your data analysis, and what will you use to analyze your data. For example, recently, there's so many softwares that are available to assist with data quality, qualitative data analysis, that you will find useful into organizing your data and arranging them, and also generating themes, as well as the coding of your data. And the other issue which was asked earlier is that there's limited generalizability. So with this kind of data, like I've mentioned, that we are more focused on richness and depth of the data. So generalizing the findings is not necessarily the main goal with this type of data collection. So you would find that those findings will only be applicable to the context where you have collected the data, or to that specific group of individuals where the phenomena or event is taking place. And it would not necessarily be the same case for settings elsewhere, such as if you are talking about the impact of poor healthcare services in the Bembe district, it will not be the same issue that you will find, or it will not, the issues raised will not be applicable in the Mopani district as well as in the Soweto region as well. So that's where we experience some of these limitations. And it's very important that you know exactly the purpose of doing this kind of data collection. Right, and that really brings me to telling you about the next session, which is now going to talk about how do you actually create meaning from the data, and that is analyzing you've collected your qualitative data now, and how do you analyze it? How do you now start that process of developing the themes, generating the codes, developing the themes, and so forth, into now interpreting it to meaningful and suitable for reporting, either as a policy brief or as a journal article. So I'm going to be touching these aspects in the next webinar session that we are going to have next Friday. And I want you to take home with this very few issues that I've talked about today. I know I've mentioned a lot, but these are very important for you to remember, as they will guide you into conducting very good qualitative research studies. And the first one is understanding what qualitative research is, and what it is. It's a non-numerical type of data collection method, where meaning and experiences matters more than actual statistical power or representation. So here, the role of a researcher is interpretive and reflexive, and it involves naturalistic and multiple realities. So we do not focus on objective measures or objective or factual data here. Here we focus on understanding the why and the how part. And why is it powerful? So we are able to talk about the emergence of theories, and we are able to capture deep insights directly from the participants. We are able to explore very sensitive topics and capture diverse perspectives within communities and organizations or different settings. And like I've mentioned, the why and how on human impact is very integral, and this type of qualitative research enables that. And some of the common methods that are utilized, or the most common methods that you need to know, which you can start familiarizing yourself with, is the semi-structured interview guide or the in-depth interviews, and then focus group discussions, the document analysis, and this could also be structured or unstructured. You need to think of the issue of the planned and open to probing. So that is the open-ended issue, or the semi-structured nature of the tool that we use, which I've mentioned as a topic guide. So a topic guide is semi-structured, meaning that you plan some parts of it and the other part is open for adaptation or open for probing, and that is based on what the participant is sharing with you, and you want to delve deeper into understanding what they're sharing with you. So I hope all that is clear. These are some of the reading resources that I have found to be very useful, and I think that they could help you as well if you really are to conduct qualitative research, and you would want to learn further. How do you do it, and how can you design your study as such? So I would like to thank you very much for being part of this session and participating way beyond the time that was planned. I really appreciate that.